Heart attack is a leading killer of both men and women in the United States. A heart attack occurs when blood flow to a section of heart muscle becomes blocked. We spoke with Dr. Bahram Eslami at Hoag Memorial Hospital Presbyterian in Newport Beach, who gives us some insight on heart attack prevention. We asked Dr. Eslami what causes a heart attack.
Heart attack is caused by sudden onset of blood flow cutoff to the heart muscle fed by an artery. The lack of oxygen damages the heart muscle if blood flow is not restored quickly by treating the blockage. The blockage often is caused by sudden onset of a plaque rupture, so-called atherosclerotic plaque, which is the buildup of the fat inside the blood vessel. This is superimposed by a blood clot, so-called thrombus, and the combination of those cuts off the blood flow and causes a heart attack.
Dr. Eslami told us some of the risk factors for a heart attack.
The precipitating causes of heart attacks would be family history. If one has a male member of 55 years of age or younger with coronary artery disease or one of its manifestations, or a female age 65 or younger, that will be considered a family history and is a major risk factor. The other major risk factor would be diabetes, which increases the chance of heart attack by 2 or 3 times, to the point that if one has diabetes, the chance of heart attack is similar to someone who already had a heart attack before. Hypertension would increase the chance of heart attack by 60%. Smoking increases the heart attack chance by 200%, also increases the incidence of sudden cardiac death. Lipid disorder like high cholesterol, low HDL, elevated triglyceride are all causes of heart attack, and more data to show that if we bring the cholesterol down and correct the lipid disorder, we reduce the chance of heart attack and death by 30 to 40%.
Dr. Eslami told us how a heart attack can be prevented.
Heart attack can be prevented by modifying the lifestyle. The lifestyle that we have is totally different from what we should have. Human genome has not changed much over the past 40 years, whereas lifestyle has changed drastically. Because we consume a lot of food, we consume a lot of unnecessary carbohydrate and pure sugar that should not be a part of our lifestyle. And in order to prevent heart attack, probably the best diet that we can follow would be a Mediterranean diet. A Mediterranean diet is a diet that contains a lot of fish, nuts, vegetable, fruit, and the main oil is olive oil or canola oil. Also, exercise should be a big part of that. It has been shown that 30 minutes of brisk walking would significantly diminish the chance of heart attack by lowering blood pressure, by lowering the weight, and lowering cholesterol, improving HDL, and reducing triglyceride. For those individuals who either have coronary artery disease or diabetes, or they are high risk, secondary prevention is recommended, which is to attain a normal weight and maintain it by means of exercise and diet. Keep the blood pressure 120/80 or less. If they are diabetic, keep the hemoglobin A1C, which is an average of 3 months glucose, 7 or less, and keep LDL below 100, preferably below 70. There are a lot of data that show lower cholesterol, less chance of heart attack again.